In today's busy world, we are always on the go, planning the next fun outing or simply trying to enjoy a peaceful day with our family and friends. However, those with Crohn's disease struggle with debilitating symptoms that can lead to worry and stress, leaving many of the invitations for fun left unanswered. Crohn's is an immune system related disease that causes inflammation within the gastrointestinal tract. It commonly occurs between the end of the small intestine towards the entry of the colon. Though this is a basic diagram on where the disease can affect, the areas may vary. According to the Crohn's and Colitis Foundation, about 780,000 Americans are affected by Crohn's disease. Men and women anywhere from ages 15 to 35 can fall victims to the disease. Symptoms include loss of appetite, weight loss, abdominal pain, urgent bowel movements, blood in stools, persistent diarrhea. There can even be tearing and fissures that occur throughout the intestinal wall that can lead to surgery to repair.
The first, the first thing that I remember is how much everything hurt. Basically, when I was first diagnosed, obviously being sort of like 17 or 18 years old, I think fear was probably the top of the list because I'd lost so much weight. I was in so much pain on a regular basis, and to begin with, nobody could really tell me why, and it took a while to get the diagnosis.
The cause of Crohn's disease is still unknown, but there has been some links to stress and diet to be a main aggressor. There has also been some evidence that shows a link to hereditary and other genetic factors. Like most conditions these days, anti-inflammatory medications and other TNF drugs are commonly prescribed to suppress the immune system's response to the inflammation within the intestines. There are also steroids and antibiotics used to minimize the risk of illness. Unfortunately, for those with this condition, the side effects of these medications are also similar to those of Crohn's, so it can cause long-term further damage to the liver and continue the painful effect. Thankfully, there is an amazing new approach out there that has been showing much benefit to those with Crohn's disease. Lifestyle medicine uses evidence-based therapeutic approach to improve nutrition through a whole foods plant-based diet, and to exercise regularly and make choices to prevent and even reverse the chronic lifestyle-related diseases. Nutrition is one of the main concepts of lifestyle medicine. It advocates for a whole food, plant-based diet that offers all the nutritional needs while maintaining a sustainable lifestyle. Foods that encompass this diet include fruits, vegetables, legumes, beans, nuts, greens, and other multigrains. Those with Crohn's disease need a gut microbiota intervention, and a whole food plant-based diet is one that has shown to be very beneficial. Unprocessed foods are an important part of the whole food plant-based diet due to the wholesome nutrients preserved that aid in the digestive process. The main goal is to consume foods that comes as close to nature's package as possible. One Danish multidisciplinary collaboration studied patients with Crohn's disease that were engaging in different anti-TNF therapies, also known as anti-inflammatory treatments. The study investigated different diets and foods that could improve inflammation within the gut. The whole food plant-based diet showed the most benefit for reducing the inflammation, and some patients had even reported that they no longer needed to keep taking their anti-inflammatory treatments. Since this disease affects the intestinal tract, a patient with Crohn's could experience different deficiencies of calcium, B12, folate, iron, and vitamin D. Much of the American diet only incorporates a small portion of fruits and vegetables, whereas a plant-based diet has a focus on foods that are rich in many different vitamins and nutrients, so the risk for deficiency of patients is very minimal. Though simply just talking about nutrition and its benefits on Crohn's is great, but making a change can be hard. Some tips that might make the switch to a plant-based diet easier, according to Consumer Reports, suggest that you could just by starting the intake of fruits and vegetables. Another option is to redesign your plate. to be more versatile in different food groups, focusing more on those fruits and vegetables and less focus on meat protein. And lastly, even trying to start with a semi-vegetarian lifestyle. Any transition comes with challenges, and making a starting point is good when considering a better diet. This is not the only diet, though, that has shown benefits for Crohn's disease. Other diets, such as the Mediterranean diet, the paleo, and carbohydrates diets, have improved overall energy and helped relieve symptoms of pain for Crohn's disease. Another important concept of lifestyle medicine that can also help with Crohn's disease is making healthy lifestyle choices. A supportive network is crucial for patients who may be struggling with nutritional changes, motivation to exercise, or even feeling like symptoms are never going to get better. Patients who take part in lifestyle medicine are presented with a physician that would use a coach-like approach to their appointments that could help guide them to the treatments that might work for their lifestyle, designed specifically for them. A coach-like approach offers curiosity, openness, appreciation, compassion, and honesty. This allows for more efficient appointments and can be a nice change from the rigorous tests and scopes that might need to be done in other visits. One recommendation that a coach-like approach uses is talking with friends or families about your treatment goals to help make the patient stay accountable. For example, if Sally tells her friend that she wants to start adding in more fruits to all her meals since she finds that her symptoms of Crohn's are minimized when she eats them, her friend will likely ask Sally later on if she's been increasing her fruit intake, thus holding her responsible for her choices. Exercise is another great lifestyle choice for people with Crohn's disease. One might not think that there is a correlation between the two. However, there have been a few different studies that have shown regular, moderate levels of daily exercise have showed favorable results towards decreased symptoms and improved quality of life. Exercise and an active lifestyle has consistently shown to decrease the possibility of other lifestyle-related illnesses and diseases as well. Though too intense exercise could in turn perpetuate the symptoms of the Crohn's disease, making the urge to go to the bathroom more and things like that. That's why we recommend only kind of a moderate or low type of exercise, but getting it in every day is very important. And these are only a few ways that lifestyle medicine can benefit patients with Crohn's disease. This disease is painful, difficult to live with. However, lifestyle medicine has offered so many different choices that a patient can utilize to minimize symptoms and hope to reach possible remission by simply making better choices. Thank you so much, and I hope you all enjoy the rest of your day.